Hi, I'm Rachael Leslie and I'm the Deputy Director of Public Health at Doncaster Council. This week I wanted to take advantage of some well-earned time off for Rupert and introduce myself with an update on what has been another very busy week in Doncaster. We've seen a sharp rise in the number of cases of COVID-19 across Doncaster at the moment, although I'm aware that these case rates alone don't really tell a full story, and I want to share some more detailed information with you. Around 25% of all cases we're seeing in Doncaster are in children or young people, so those aged under 19, and we know that this has impacted many of the schools across Doncaster in recent weeks. The next biggest age group where we're seeing cases is in the younger working age group, so those people aged between 20 and 34. If you're in this age group and you've not yet booked your vaccination, I do encourage you to book that as soon as possible. This pattern of seeing high numbers of cases in the younger age groups is what was observed across the northwest when they started to have peaks and increases in cases over the past month or so. It is likely that case rates in Doncaster will continue to rise over the coming weeks. Almost all cases that we're now seeing in Doncaster are of the Delta variant. The key thing we're all interested in is how this rapid increase in cases has affected our hospital admissions locally. And it's true that the vaccination programme has weakened but not yet broken that link between cases and hospital admissions. Although admissions have gone up in the past week and we're now at around 18 across all hospitals, we haven't seen that same sharp increase that we saw previously when cases were so high across our communities. Sadly, there are currently 4 people in the intensive care unit across the hospital, and all of those are aged under 40. And they're all unvaccinated. In fact, all the patients that we would consider as very ill are more likely to have not been vaccinated. This really does show the importance of the vaccination programme, and I really would encourage you to come forward for your vaccination as soon as possible. Although the vaccination doesn't mean that you definitely won't catch the virus, it does mean that you're less likely to become very unwell from it. There are lots of pop-up vaccination clinics open across Doncaster this weekend, including at the Keepmoat Stadium, Rutland House, Thorn Leisure Centre, Dearne Valley Leisure Centre and Yorkshire Wildlife Park. Do check the Doncaster CCG website for more information on how to book your vaccine or how to go along for your vaccine at any of these locations. The Prime Minister's announcement earlier this week, as I'm sure has been welcomed with excitement by many of you, but equally this has caused anxiety for others. As exciting as it might be to think about life without restrictions, it's important to remember that at the moment there are restrictions in place, and with the virus circulating at such high numbers in many of our communities, it's more important than ever that we do our best to stick with them. The best way that you can limit your risk of catching or spreading the virus are do your lateral flow tests weekly, practice good hand hygiene, keep your distance from others, use face coverings in enclosed spaces, and if you do become symptomatic, then access testing as soon as possible and isolate. For those of you who are feeling anxious about the lifting of restrictions, there is support available. Please do visit the dedicated COVID web pages on the Doncaster Council website for more information. It's more important than ever that we don't drop our guard now. We do go along and get vaccinated, and we do support each other to stay well. Let's carry on doing it for Doncaster.